So started working with him about 2 years ago, and on the first visit said, well, we need to get rid of these shoes. Like I look at his shoes and he's got the old school like New Balance shoes that are like a brick with an insert in it. And I said, well, this is what is feeding into your problems, and it's going to make it really hard for us to make progress. So we got to get rid of these. And he's like, wow, you're the first one that's ever said that. So after I educated him, and there wasn't really pushback, he was just surprised that I said that. And after he got off the table and walked, he's like, well, what you did now is more results than I've had in the last 5 years of dealing with podiatrists and old school PTs and all that kind of crap. So I'm going to trust you. So he bought right in on the first visit. Great patient, compliant, comes back for his second visit, literally with 4 different pairs of shoes. So I said, so here's what I want you to look at for your next pair of shoes. Gave him a couple models that would be not completely minimalistic, but definitely not what he's been wearing. Told him to get out of the orthotics. If he can, walk barefoot at home. If he can't be barefoot, at least be in a pair of loose, flimsy Crocs or house shoes or whatever. So he comes back for his second visit with literally 4 pairs of shoes that he bought from Shields. And they're the 4 pairs of shoes that I told him to check out. So he brings them in and says, are these the shoes? I was like, yeah. So we go through it and said, okay, let's stick with these, take the other 3 back, try these for a while. He likes those. For like, I think his like 4th visit was like 2 weeks later, 3 weeks later, something like that. He comes in with more shoes. How about these? Like he's all in on trying these different shoes because he wants to wear like 4 different pairs of shoes and rotate through them. So he's all in. Fantastic results. Brings his wife in. His wife is a train wreck. She's had terrible foot issues with foot and ankle fusions and all kinds of crap going on. So work with her, everything's hunky-dory, fine. Okay, so where am I going with this story? What's this got to do with the podcast? Here we go. So I see him on and off, and so the whole purpose of his change of shoe wear and getting more active is they were going on all these vacations that required walking, and he was terrified that he would get to these vacations and have so much pain that he wouldn't be able to walk and enjoy the vacation. So he goes on his vacations. They do great. She does great. Fantastic. Everybody's happy. Wife comes back about a month ago with sciatica, so start working with her again. He's not coming in, so I'm figuring he's doing well. So he comes in and drops her off for her visit, and she's seeing one of our therapists here. I'm talking to him in the lobby, and he said, well, can you watch me walk and tell me what you think? So I watched him walk, and I said, well, it doesn't look like you're walking as well as you were last time I saw you, so I'm inferring that you're asking me to watch you walk because you know you have problems with what's going on, and you're basically asking me if you need to make an appointment. And he said, yeah, pretty much. And I said, yeah, you need to make an appointment. It's been like 6 months since I've seen you. Your gait is rigid, your stride length is short, so we need to get back on this. He said, okay. So he comes in yesterday, working on his legs and stuff, and I watch his shoulders. I was like, well, your shoulders look really tight too. He's like, yeah, I've been going to XPT across town for my neck and shoulders. And I'm like, what are you doing that for? He said, well, I had some numbness down my arm, and so I went to the doctor, and they said, go see this physical therapist. And I said, okay. And then they sent you to that place. And he said, yeah, the doctor is really happy with that place. And I said, the reason why the doctor is really happy with that place is because they take him lunch every week. I guarantee you they are buying referrals with lunch and water bottles and calendars at the end of the year and thank you cards and all kinds of bullshit that shitty physical therapists have to resort to buy referrals from shitty physicians. Okay, so that's what's going on, and this is what's going to lead to the podcast. So I said, so what are they doing with you at X Physical Therapy? And I already know what they're doing with them because they do the same thing with everybody. He said, well, they're stretching out my neck and they're giving me these exercises to make my shoulders stronger. And I said, okay, how's that going? He's like, well, it feels really tight when they're stretching me out. And then when I leave, it kind of feels a little bit better. But then, I feel like I'm the same, and I've been going. And I said, so how long have you been going there? And he said, well, I go twice a week, and I've been going for about 2 months. I said, how many times did I have to see you to fix your foot problem that you had for years? Did you see me 2 times a week for a couple months? He's like, no, I had results after the first visit. And I said, that's why you need to stop going to X Physical Therapy, and I'm going to fix your shoulder and your neck today.